everyone, and welcome to Gruff Talk, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I'm your host, Barbara Hannah Grufferman. Thanks to all of you for tuning in every week. I so appreciate you. And I am grateful for all the emails I get from you recommending guests and topics for the show. If you have a good idea for me, send an email to grufftalkpodcast@gmail.com. Today's episode was created as a direct response to a question a listener had about a common, inexpensive, and easy to get medication, Metformin. As you'll soon hear from my very frequent guest, Dr. Margaret Nachtigall, who is a reproductive endocrinologist at NYU Langone Health in New York City, Metformin is a very interesting drug. It helps manage type 2 diabetes, but as many highly regarded longevity experts now believe, it can also play a role in extending your health span and possibly even your lifespan. Lots to talk about, so plop down in a comfy chair and let's get started. Hello, Dr. Margaret, and welcome back to Gruff Talk.
Hi, Barbara.
So there's so much conversation out there about Metformin, and I've been getting a lot of questions from the Gruff Talk readers about Metformin. What is it? What does it do? Why is everyone talking about it? And so we want you to tell us first, what is Metformin?
So Metformin is a medication, a prescription strength medication that's FDA approved for the treatment of diabetes. It is actually an insulin sensitizer. So what it does is it helps the tissues in your body recognize your own insulin better. And because it's doing that, it lowers insulin level and helps with glucose control, so sugar control. So that means that the things that you eat can be processed and turned into energy more efficiently. And so lowering the insulin will have effects on your body. So that's what Metformin is.
Okay, and who is this really for? Like, who would you prescribe Metformin for? Who's your typical patient who would get that?
Well, that is a really good question because in 1994, FDA approved Metformin for the use in type 2 diabetes. Now, since then, there are a lot of what we call off-label uses, which means that they are beneficial and useful for individuals that might not meet the criteria of type 2 diabetes. So for instance, I take care of a lot of patients who have polycystic ovarian syndrome. And it just so happens that those people are often insulin resistant. And so Metformin is excellent at being able to help with the features and factors that occur in people that have polycystic ovarian syndrome. So just like PCOS, there are other uses that Metformin's been helpful for. Anyone that has evidence of insulin resistance can probably benefit from Metformin treatment. So someone with obesity and insulin resistance, someone with PCOS has insulin resistance. Those are people that would benefit.
So insulin resistance, let's talk about that for a minute so everyone understands what that is, how it can be manifested in the body, right? So does everyone with type 2 diabetes, for example, are they insulin resistant? And then, and also
really
who else, like, what if could I not be type 2 diabetes, but diabetic, but yet be insulin resistant?
Yes, you can absolutely be insulin resistant. And there are all sorts of degrees of insulin resistance, but not have type 2 diabetes. Insulin resistance is really almost a pre-diabetic state. And if you can improve your insulin sensitivity, then you could probably prevent yourself from developing type 2 diabetes in many situations. Of course, this doesn't translate into everybody. So insulin sensitivity is the ability of the cells in your body to respond to insulin. And what insulin does is insulin, when you eat something, it has a certain amount of sugar in it, of glucose or whatever your nutrient you're eating. So when that comes into your body, it will be recognized by the tissues in your body and signal the pancreas to make insulin. In order for insulin to have its effect, to break down that food into usable energy, because that's why we want glucose around, insulin has to bind to its receptor. And so if you can imagine, say, a ball in a socket, if a round ball is meeting a socket that is curved, it's going to be easier to grab that insulin. But if it's square, it won't meet as well. So what metformin does is it helps those square receptors turn round. Now, I'm just using this as an example.
That's a very good visual. That helped me.
Right, basically, it's allowing the insulin to meet its receptor better. And so by improving that ability to bind, we are making it easier for insulin to do its job. So if it can't do its job, if the receptor is very misshapen, then you need extra insulin around to be able to do the same job, which is to take that sugar and break it down into energy. So if we have too much insulin, insulin can cause some negative effects on the body. It can increase inflammation. We even think it may be a bit of a growth promoter and maybe even develop into more cancer. But certainly with increased insulin, that causes an increase in weight and more fat to be deposited.
And
also,
that in and of itself,
levels,
of course, can have its own health risks.
Exactly. Can translate an increase in adipose tissue, can lead to an increase in cardiovascular disease. And so by having this extra insulin around, we have some negative factors. And so metformin is an insulin sensitizer. And so it's helping the body process sugar and helping sugar levels be lower and also enable you to reverse the effects of too much insulin.
Can you also reverse your insulin resistance if you have that issue with lifestyle? Is that possible?
Well,
or do some of us need a medication?
No, we don't all need medication, and that's where degree comes in. So mild insulin resistance usually isn't treated with a prescription medication. And exercise is fabulous at being able to help people reverse their insulin resistance. Losing weight also can help with decreasing your insulin resistance, and also eating a low carbohydrate diet, eating a diet that has very even sugars, having a lot of protein, actually even a little bit of fat in the diet can improve.
Healthy fat.
Because fat is long acting, protein is long acting, whereas sugar, straight sugar, is very short acting and causes an increase in insulin and then a fall in insulin.
Mm-hmm.
So eating a diet that is low carbohydrate, doing a lot of exercise can help decrease the insulin resistance. Some insulin resistance is genetic and some insulin resistance is accumulated from behavior or diet, exercise. But some of it is genetic. There are many people that eat perfectly, healthily, exercise regularly, are thin, and yet are still insulin resistant. So it's not all about the environment.
And then how would one know? Is this something that you can get a test for? Like, would this be your glucose level?
Yes, we look at fasting glucose levels. Mm-hmm. One way of being able to see what your insulin resistance is like. There are very sophisticated tests that can look at insulin and glucose level. But to try to do it simply, getting a blood test when you're fasting over 8 hours of fast, and then to get a fasting insulin and glucose, you can also get a stimulated test, which is having a high glucose load, either in a sugary drink or carbohydrate, and then 2 hours later, getting a postprandial or after eating blood test of your sugar and your insulin. And some people do really stimulated tests where they do a 3-hour glucose tolerance test. So you come in fasting, you take a specific dose of a sugar drink and then measure the sugar levels at 1 hour, 2 hours, and 3 hours later, and also measuring insulin at the same time. And then you can see what your insulin does and what your sugar does over time. So these are blood test ways.
Sorry to interrupt you. Is there any connection between an increase in insulin resistance and age and or being postmenopausal?
Yes, it definitely, that's another question, but it does get worse with age. One other blood test I just wanted to mention, and then I'll answer those questions, is a hemoglobin A1C, which is a measure of glycosylated hemoglobin. And what that does is it measures the sugar level over the last 3 months. So it's not just on that particular day where you came to the lab and what is it? It's what did your sugar levels do over the last 3 months? And it's an average. So it gives you an idea. If you know that your average sugar level is high, that tells you one thing, but this tells you also the degree of variation. So if your hemoglobin A1C level is very high, that means that your sugar level has not had very good control and it's been up and it's been down. Whereas if it's low, on the low side, it shows that you've had good sugar controls and they've all been very similar, which is a good sign. So now your next question, yes, insulin resistance tends to get worse with age, and less, of course, as you're aging, you're getting healthier and healthier and exercising more and eating
as we try to convince, always try to convince everyone to do.
You can actually improve your insulin sensitivity. And then there are, you said postmenopausally. Well, very interesting is that estrogen happens to be an insulin sensitizer. So the lack of estrogen actually does cause a relative insulin resistance. So many people who go through menopause notice if they're not on estrogen replacement therapy, they are noticing that they become relatively insulin resistant. And that's why weight can accumulate right in the middle where we don't want it to, because that central obesity, central adipose tissue is an increased risk for developing heart disease and other factors.
Absolutely. So really being on hormone therapy can help with this issue.
It can.
But also metformin. It can as well.
Yes, metformin is an option as well. And as we were talking about those off-label uses, that might be an off-label use. You know, I like to be careful about prescribing it to individuals that do need it because there are some negative effects. There are some side effects. Usually when we talk about a medication and its side effects, usually talk about maybe 4% of people who develop it. But in metformin, it's about 20% of individuals will actually have some side effect. And the side effect can be really mild, some nausea, some stomach aches. Some people get some diarrhea. Some people get some constipation. But some people, it gets severe. So it depends on the individual. In fact, some of my patients have had to discontinue the medication because of such severe nausea. So that is something to consider. The other thing is because it is metabolized through the liver and excreted through the kidney, that people that have decreased kidney function can get an acidosis, which can be very dangerous. It's very rare, but it can occur. So you really want to make sure that the individual that you're treating has good kidney function. That can be measured, one, in how the kidneys are clearing the urine, also in a blood test called creatinine. So anyone that has an elevated creatinine would be someone that I wouldn't want to put on metformin. And anyone that has chronic liver disease is someone that also I would be wary about putting them on. So, you know, it's a prescription medication. It is something that can have some negative effects, even though it does do some great things.
Right. And it does sound like, tell me if I'm wrong here, that metformin for this issue, for insulin resistance, sounds like it might be the gold standard in a way, or are there other medications out there?
I mean, this was one of the first insulin sensitizers, but because some people can't take metformin or because it's not working enough for them, they may need other agents. And so there are newer insulin sensitizers. We've talked about the GLP-1 receptor agonists that are out on the market and very popular right now, which are very effective in decreasing insulin resistance and improving weight, decreasing weight.
Are we talking about Ozempic, for example?
Ozempic, Wegovy, Mounjaro, all of those are medications that are out there now.
Dr. Margaret, just a very quick note. At the Academy Awards, at the Oscar nomination show, I watched, there was in the opening, there was a joke about Ozempic. And I have to imagine if there's an actual joke about Ozempic, it's become very, very popular and very well
Very
known
popular.
in the
That's
cultural
interesting. I'm
discourse.
sorry I missed that.
Yeah, I really had to laugh. So, I also wanted to talk with you about metformin as a tool for some people, I think are viewing it this way, a tool for like an I hate to use the word anti-aging, but to like kind of extend the health span and possibly extend the lifespan, and I'm hearing about this and reading about this from longevity experts who have been researching this for a number of years. This is not new. And a few of them out there really seem to be quite gung-ho on metformin specifically to put in your toolkit to extend your life. What are your thoughts on this?
Well, I have to say, I think it really warrants future research. I think that more research is necessary before I would say yes or no on that. What I do think is that because insulin resistance is probably so common, that is likely an explanation for some people developing more inflammation, more cancer. And when those people are treated with metformin, then the incidence of their chronic inflammation and risk for cancer diminishes. So it does look like metformin has had an effect, and had this positive effect. So I don't know if the research so far that looks favorable in terms of reducing inflammation, reducing chronic inflammation, as well as in reducing cancer and prolonging life, is whether that it has been proven. I don't know where I stand on that. I do think that if someone does have a higher risk for those factors because their insulin is high, certainly it makes sense to try this if they don't have any of the contraindications. But I don't think that we're at the point yet to say that this is an agent that I would use necessarily just for improving longevity in someone that doesn't have any of these factors. But I do think that the research exploration is a great idea. I'm all for that. And maybe it will show that independently that it does have the ability to decrease inflammation and decrease the cell proliferation independent of insulin. And maybe that will be beneficial and will help us decrease aging. Certainly in some of the longevity studies that have been done when they looked at individuals who have lived to over 100, aside from those people tending to work a lot and be happier and have community and friendships.
Social networks. Mm-hmm.
That has been shown. In addition, insulin sensitivity has been something that they share. So maybe that is something, and maybe those factors. So I'm
very fascinated by what you brought up as the connection between inflammation and insulin resistance. And then let's just go back for a minute to these people that you're talking about who do live to a ripe old age. And, their health span clearly was extended, as was their life span. But they're really following like what the blue zones people do and how they live with the community, the social networks, but they eat well. They don't eat too much. Their weight tends to be like at a healthy weight. So you've got all of these lifestyle factors, which I'm assuming are having an impact on their insulin resistance and then therefore having an impact on their inflammation in their bodies. It's just an incredible connection. All these dots that are connected.
And their genes as well.
And their genes.
I think there's also a genetic component to longevity as well. And I think it also comes down to what we say about everything, which is that it's an individual choice that for some people, it's probably the best answer to prolong their life. And in other people, it's probably not. So I think that we can't translate this to everyone, but it certainly is interesting. It's an interesting medication. I can tell you that when I first learned about metformin, I know that I was a fellow at the time. and my co-fellow was studying metformin as a potential treatment for polycystic ovaries. I didn't see it. So what are you talking about? How is this going to decrease hair growth and get rid of acne and cause weight loss? I couldn't even fathom this. And he was really, really early in the game in being a huge proponent for metformin and saying that it was going to help us all do everything. We'll see.
That's amazing.
Research.
And
yes,
metformin,
research.
another reason why the longevity experts specifically are such fans of it. Also, it's quite accessible. It's inexpensive.
That's true.
And it's an accessible drug, unlike Ozempic.
Right.
For example.
Right. It is inexpensive, which is nice. And other than the fact that it does have some side effects and can have some risks, it is relatively safe medication and easy to use and often worth a try. Again, I don't know that this is going to be the longevity magic that we're looking for.
The magic pill.
But it does have some really nice effects, as you said, by reducing inflammation. That's a really great benefit for our bodies, and maybe it decreases proliferation. So there may be some great benefits.
Yeah, I'm looking forward to more research on this because I personally find it very, very fascinating. Been following it for a number of years. But a new study came out recently, Dr. Margaret, which you actually shared with me about how metformin can, with certain people, I believe it's those who were unvaccinated more, but you'll explain that to us, that metformin can help reduce the effects of long COVID.
It was an interesting study. It was done on a wide range of ages, 30 to 85-year-olds. And it was used in all the patients that were entered into that study were all overweight, and they all developed COVID. And what they found, first they found that those that were vaccinated had a much lower chance of having severe COVID, getting admitted into the hospital, or having long COVID. So that was one thing. Vaccination was very helpful. The other was that those that were on metformin had decreased severity, decreased hospitalization, as well as decreased incidence of developing long COVID. So they did see that it was beneficial in that particular population, in the overweight individuals. So it's possible that those patients actually had insulin resistance. And so it was improving their insulin sensitivity. And we know that improving insulin, we know that insulin resistance and type 2 diabetes is a risk factor for developing severe COVID. And we saw that before the vaccine came out with the initial stages of COVID, where patients who are insulin resistant or particularly have diabetes had more severe COVID. But it is interesting, and certainly in that situation would be worth trying.
Yeah. Metformin, it's quite the little powerful drug. What are your three best, most important takeaways you want everyone to remember from our conversation about metformin today? We covered a lot, but what are your three?
Well, I think the big thing in summary is that one, it's FDA approved for the use type 2 diabetes. Mm-hmm. Two, there are some off-label uses, which are to correct insulin resistance and maybe even prevent diabetes in individuals who are prone
and also right? Like the pre-diabetics.
Right, exactly.
Mm-hmm, mm-hmm.
To be able to prevent the development of diabetes. So I think those are reasonable uses. That it's not for everyone. I think that it is certainly for anyone that has a high insulin or insulin resistance. And I think to be aware of the risks of having high insulin and continuing a healthy diet, getting adequate sleep, getting good exercise, and most importantly, not smoking, and just being a general healthy state. And certainly metformin is an option for individuals that have certainly severe insulin resistance, mm-hmm. and individualized.
Always. I mean, you always end just about every conversation we have on Gruff Talk
Right.
with exactly that. All of those things. Be healthy, everyone, right? Exercise and everything that Dr. Margaret just said. But also all of this is very, very personalized and individualized. Talk with your healthcare provider, right?
Right. Exactly.
Always nice having you on the show, Dr. Margaret. You'll be back soon. We always have stuff we like to talk about and cover. And I always love to have you come on so you can explain it to us, because without your input, I don't know, we wouldn't understand a lot of this. So thank you so much.
Oh, thank you. Always good to talk to you. Really, really good to talk. And have a good rest of your night.
Talk to you soon.
Okay, bye.
Thanks for tuning in, everyone. If you enjoyed this episode of Gruff Talk, please do 2 things. First, share it with all your friends and family, and subscribe to Gruff Talk wherever you listen to podcasts, including YouTube, so you never miss a single episode. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.